2025 is a very interesting time for ET treatment and for patients and providers. My talk really focused on two main aspects of treatment. One, the second line patient who's seen hydroxyurea and either has some side effects or doesn't have therapeutic benefit with it. There's been recent publication or top-line results of the SURPASS ET trial, which studied Ropeginterferon versus Anagrelide for the second-line treatment of patients with ET. And that found significant benefit for Ropeginterferon versus Anagrelide, not only in blood count control, but decreases in thrombohemorrhagic events, as well as decreases in the driver allele burden, which we believe might be linked to disease progression. On top of that, there's studies looking at LSD1 inhibitors like bomedemstat, as well as other agents in the second-line setting. So I think that's one very rapidly evolving area. And the other thing I focused on really was the development of these CALR specific therapies, which could be treatment options for up to a third of patients with ET and are a more targeted and individualized approach for treating this disease than the kind of blanket approach of hydrea or interferon for everyone.